Pain under the shoulder blade. What causes it and how can you get rid of it? A lot of people think that pain under the shoulder blade is just pain. But in reality, pain under the shoulder blade often points to a much more serious problem, and it can trigger a range of negative symptoms. These include headaches, dizziness, fatigue, a feeling of heaviness, and a sense of fogginess in the head. In some cases, it can even lead to panic attacks and a sense of anxiety right here, meaning a feeling of unease and tension in the chest area in the front. In this video, I'll explain why pain under the shoulder blade occurs and give you 5 tips on how to get rid of it. So make sure to watch this video all the way to the end. Let's figure out what you absolutely shouldn't do when you experience pain under the shoulder blade. Taking painkillers. By the way, if the first thing you do when something hurts is take a painkiller, give this video a like. You shouldn't do that because you're just masking the symptoms. Sure, the pain might go down, but you're not dealing with the cause, and it will just keep building up. And actually, time will be working against you. Second, applying heat to the area that hurts. Again, when something starts to hurt, a lot of people immediately go for a hot bath. They soak in a hot tub, maybe add some salt, and it seems to make things feel better. Or, for example, they go to a sauna and patients often say, "I felt a bit better, but then the next day it just hit me and it got way worse." Let's add to the list in the comments. Share the methods you've used to get rid of your pain. And I'll reply, letting you know whether it's harmful to your body or actually works. Why is pain under the shoulder blade dangerous? Let's break it down in detail. The main source of pain under the shoulder blade is most often inflammation and displacement in the area where the vertebrae connect with the ribs. These are complex joints. Each rib has 2 joints that attach to the vertebra above and the one below. And if there's a slight displacement in the segment, and most often it's not just one joint or one rib where this happens, a block, pain, and inflammation develop in that joint. So what attaches here? Look, right here are the intercostal muscles. Along the edge of each rib runs a large nerve, which goes and attaches in the area of the sternum. And inflammation immediately causes a spasm of the intercostal muscles. Inflammation also spreads along the nerve itself. That's why pain under the shoulder blade often radiates forward somewhere. This means that inflammatory processes are traveling along the nerve. So what actually allows a person to breathe? So when I inhale, my ribs expand, the intercostal muscles open up. But if everything here is in spasm, then naturally the breath will be incomplete. And usually a person breathes worse with the lower border of the lungs, the lower edge, and the upper one. Basically, the breath only happens here. In other words, the blood's oxygen saturation gets worse. And very often, we even see in blood tests a decrease in hemoglobin levels, well, a lower amount of hemoglobin in the erythrocyte. This means that something is wrong with the lungs. And one of the reasons is this strong spasm. Another very important point, the ligament of the pericardium attaches in the area of the 4th thoracic vertebra. This is the ligament of the heart sac, the pericardium, which attaches directly to the vertebra. If there is any displacement or restriction, the ligament becomes tense, it spasms, and it directly affects both microcirculation and the functioning of the heart. So, in reality, this area right here has huge muscles, and through these muscles passes a large number of major veins. And imagine if this area is in spasm, what happens to the veins? They also go into spasm. So what happens as a result? The outflow of blood from the head is disrupted. Because of this, people often feel discomfort, a heaviness in the head, a sense that even though they got up and woke up, they still feel tired, even though it seems like they slept well. So there's this feeling of grogginess, brain fog, quick fatigue, and maybe even a rapid loss of concentration because there's no normal blood flow or supply. And the pervasive feeling of anxiety and the sudden onset of panic attacks are most often caused and subsequently maintained by the persistent sensation of discomfort and noticeable tension in the very front of the body. Because this is where the intercostal muscles attach, the ones that come from this side, it's just another attachment point for them. And a person feels tension in this area, which causes anxiety. Then they get caught in a vicious cycle because the anxiety triggers more stress in the body, even more spasms, even more stress, and we end up in a state where, well, we simply can't cope with it. All of this is caused by poor posture. In other words, it's a situation where a person slouches, meaning that in this position, They create the conditions for microdisplacements to occur here and for movement restrictions to form in the joints. And at some point, when inflammation arises, this whole reaction is triggered. That's why one of the most important things is to work on your posture. Although I'll mention one more thing. Very often, people get stuck in a vicious cycle because the displacements in this area simply won't let a person stay in this state for long. That's because in this state with the displacements, the muscles are in spasm. In this position, we're stretching them, and it seems like it's easier and more familiar to stay like this. But when we try to keep our posture straight, the spasm intensifies and the muscles get tired quickly. And again, you want to sit back in that position. So, to break this vicious cycle, you need to get all the joints between the vertebrae moving. Also, athletes are at risk of developing displacements in the area where the vertebrae connect or where the vertebrae meet the ribs. In other words, people who put extra strain on their bodies. I would even say not just professional athletes, but amateurs too, because they often train incorrectly with poor technique, improper weights, sets, and so on. Besides that, of course, people who spend a lot of time behind the wheel often suffer from pain in the thoracic spine. Drivers are forced to drive in this position, often slouching a lot, and sometimes staying behind the wheel for hours. The most reliable way to get rid of this pain once and for all is to eliminate the cause of the pain. If the cause of the pain is related to a displacement, then that displacement needs to be corrected. And the main method that corrects this displacement is manual therapy. This technique is aimed at getting the joints moving. That is its direct purpose. And as soon as all the small joints here start moving and everything begins to work, the risk of developing this pain will completely disappear. So it's very important that the source itself is eliminated in order to fully stabilize the situation so that the joint works and muscle memory is retrained. And we do have such a thing as muscle memory. So we get the joint moving, but at first the muscle will still try to maintain that initial state of tension that was there. And with each subsequent session, and as the joint opens up, this will lead to changes in the muscle and a balancing of muscle tone between one side and the other. It's important that the muscle tone here is even. On average, this takes about 5, 7, or at most 10 sessions. This is related to how advanced the issue is, or let's say, how long a person has been accumulating this problem. Accordingly, with younger people, we can sometimes resolve it in just a few sessions. For older individuals, it usually takes more time. And it's also important to understand that it's our lifestyle and habits that lead to problems with the musculoskeletal system. And here we always explain what needs to be done for prevention, what exercises should be performed. In other words, we actually give them the exercises physically. We print out the exercises and then the patients do them. We explain how to take care of your spine so it doesn't hurt. And our patients follow these recommendations. And as I promised, here are 5 tips for care to get rid of the pain. You can take a regular tennis ball and, for example, press it against the area where it hurts in the wall and roll it over the spot where the pain is strongest. So do it like this with some pressure, just like that. Over time, literally within 1, 2, or 3 minutes of this targeted pressure on the painful area, the pain will start to decrease. That's the first tip. You can repeat this exercise, for example, twice a day, morning and evening, for 2 to 3 minutes each time. Second, the muscles that are in spasm here would really benefit from being relaxed in order to improve microcirculation and blood flow. That's why you can do a very simple exercise called the boat. That is, when we lie on our stomach, bring our shoulder blades together, and lift our head and shoulders. If this exercise, let's say, if the pain allows you to do it, you can hold the tension statically for about 10 to 15 seconds, and after just 3 to 5 repetitions, the pain will also start to decrease. Third, applicators will also be very helpful. That is, it's a mat with little needles that you need to lie on with your thoracic spine so that it presses right here. The needles will stimulate the area where it hurts, and you need to cover the whole region, both where it hurts and the opposite side where it doesn't hurt. And in the area where the pain appeared, the peripheral receptors will be stimulated. As a result, the pain will also decrease because the brain itself will send signals to reduce the pain there. Plus, microcirculation will improve in the region where the swelling occurred. So the swelling will also go down. Fourth, if the pain is recent, literally happened today or yesterday, for example, you can apply cold to the painful area, but only locally. For instance, there are special cold compresses that also help reduce swelling. In addition, lidocaine patches work really well. You can buy them at the pharmacy. A lidocaine patch is applied to the area where it hurts. Lidocaine generally works as a pain reliever. And when there is, so to speak, local pain relief, the body immediately relaxes the spasm in that area as well, because it breaks the vicious cycle where pain intensifies the spasm. The spasm increases swelling, the swelling increases pain, and so on. So this breaks that vicious cycle. That's why lidocaine patches will work effectively. And fifth, it's the use of compresses with dimexide. That is, you take dimexide, Novocaine, and if the pain is very severe, for example, dexamethasone. All of this is mixed together. Water is added in a ratio of 1:3. Gauze is soaked in the mixture, placed on the painful area, then covered with plastic wrap and a blanket or something similar to keep it warm. The person stays like this for about 15 to 20 minutes under the compress, and these should be repeated daily. If the pain is severe, you can do this both in the morning and in the evening. For moderate pain, you can do it only in the evening and repeat for 5 to 10 days. This was Sergey Dlin with you. This channel is about what you need to do for your spine and joints to stay healthy for many years.